6:14 is the time right now. Make no mistake, cold and flu season is here, and we've got the flu, RSV, COVID, even norovirus.
That's right. Now, when it comes to COVID, there's been a noticeable jump in transmission over just the past few weeks. I went through the latest numbers from the state health department and found an uptick in reported cases between November and New Year's Day, right during the holidays. The official number is just over 4,300 cases, but many cases are confirmed at home and not officially reported, or not confirmed at all, but we know they're still circulating. Also saw a jump in COVID-related hospital visits at the end of the year as well. Towards the end of December, ER visits hit their highest point in months.
And in order to avoid viruses such as RSV, flu, COVID, and so much more, a lot of people may be considering, should I mask up more?
Well, 7 News Detroit reporter Megan Daniels is getting perspective from some Metro Detroiters as well as a couple of health experts to see if now is the right time to begin masking up.
Since the pandemic officially ended, not many people have been masking up, but it's not a practice some people are ready to part with. And with the rise of the quad-demic, more people may be turning to old ways.
At the grocery store, just like out and about, and obviously in doctors' offices, it's all coming back to where everybody has to wear them, even if they're not working on you directly.
As COVID, RSV, the flu, and norovirus levels continue to rise.
Some clients are walking back in the store with masks on. We don't reinforce it yet, but we're starting to see it to come back.
While some experts have coined the term quad-demic, Dr. Leah Monday says it might sound scarier than it is.
Our levels actually are not higher than normal. They're just going up to how they were.
Dr. Monday tells me because of the protocols put into place during the COVID years, experts are comparing the current levels of infection to the rates of infection pre-pandemic.
We are beginning to see some of the return to the pre-pandemic patterns and levels that we've been waiting for.
Meaning we are on track to have a normal rate of infection year, according to pharmacist Rudy Najam.
Usually around this time of the year, we do have a huge flare up, after the holidays, everybody got together, you have New Year's, you have Christmas, you have lots of indoor events, crowded places. So this is the busiest week in a pharmacy or a drugstore.
And during this sick season, you might see people masking up more frequently.
I can definitely see masking coming back to a bit, but I don't think it's going to be to the extent that it was.
We do have some clients that still, played very safe and on the cautious side. They still wear masks till this time. It's not as popular anymore.
But it shouldn't be cause for alarm.
For, larger droplet illnesses like influenza, RSV, other types of pneumonia, masking is extremely effective for reducing the spread.
In this post-pandemic world, masks are becoming part of illness prevention, especially during cold and flu season.
I think the change has really been people trying to safely re-engage in society the way we did before COVID, and masks are a crucial part of minimizing the spread of all these things that happen in the winter.
And when it comes to norovirus specifically, Rudy, the pharmacist, says hand sanitizer will not kill it. You must wash your hands with soap and water. In Livonia, Megan Daniels, 7